All right. Hi, everyone. I think we have to start now. Thank you so much for joining this meeting, and I hope that we all will have a really good discussion today. And the purpose of this meeting isn't just about informing you what is going on, but I hope that we can have an open discussion, a space for the companies here. I noticed there are some companies here that you can ask questions and dig deeper into the topic with the experts who are speaking today. And of course, there will be, the session is recorded, as I mentioned, so you can watch it later or you can share it forward. But I hope that you will ask and interact as much as possible because we have small group of people. Our target is just to have 20 people max in this meeting. So, all right, about today, first of all, I would like to say a few words about the testbeds ecosystem we have. So me together with Marco Ro from Tampere University Hospital, we are facilitating a project for Tampere health testbeds, including about 10 to 11 different testbeds from the city of Tampere, from Tampere University Hospital and the city of the Tampere University. And we are trying to together build service packages from these organizations for companies. So it means that a company can use these testing facilities for your research and developments. If you are having medical device or software, whatever you want to test, you can always reach out to these people. And today we have the case from Biobank, Tampere Biobank, and then also we have HeAT Lab from Tampere University. And from Business Tampere side today, my name is Van. I'm business coordinator for this project, and I'm also coordinating the Tampere Health ecosystem. And with me today is Anne. Anne is going to be the moderator of this event. She will take care of the slides and all of technical related tasks. And next, I would like to introduce our partner, Finnish Clinical Biobank Tampere, Enni and Paula. Enni and Paula, you can, if you want, you can put on your camera and you can start speaking. I will turn on the next slide now.
Hi, everyone. My name is Enni Makkonen, and I work as a research coordinator at Finnish Clinical Biobank Tampere.
And hi everyone, my name is Paula Nurmi and I work as a service coordinator together with Enni at Finnish Clinical Biobank Tampere.
So yes, together with Paula, we coordinate the Biobank research project and help researchers to find what they need in their biobank or any research projects. And we operate as a part of Tampere University Hospital. And the aim of the Biobank is to make medical research easier and more efficient for both academic and industrial-based researchers. So on the next slide, there's more information about how all this is done. So through Biobank, you can get an access to both the data and samples related to those samples and the samples and the data related to the samples. So we have currently about 40,000 individuals who have given a biobank consent and samples. And also we have a huge collection of old diagnostical samples that have been transferred to the Biobank. There are more than 3 million of these samples from about 400,000 individuals. And also, as I said, we have a possibility to combine data to these samples. This data is basically the electronic healthcare record data from the hospital registers, but we also have a possibility to combine the data from the previous Biobank projects to these samples. And an excellent example of this kind of data is genome data that has been analyzed from the Biobank samples. On the next slide, here is more precise information about the sample collection we have in the biobank. So we have prospective blood sample collections from the consent given people. And we also collect prospectively cancer tissue samples and ctDNA samples from selected cancer types. And then there's this huge collection of old diagnostical tissue samples transferred to Biobank, and also a collection of clinical genetics samples. And these old collections have been collected before the Biobank law came into an action in 2013. Next slide, please. And as you can imagine, these samples would be worth almost nothing without the data related to them. So we have a possibility to combine the samples with electronic health record data from the hospital registers, and also several public healthcare registers, such as cause of death registers and prescription registers, etc. And also we can combine laboratory measurements to the samples, for example. And on the next slide, I tell you more about another interesting and quite new possibility the Biobank can offer. It's called recall studies. And this means that we have a possibility to recontact individuals who have given a Biobank consent and a sample, and also agreed to be recontacted for research purposes. And about 90% of the people volunteer to be recontacted for study purposes when they are giving their Biobank consent. And for your study needs, the study subjects can be chosen by any criteria within the Biobank and hospital data registers. It can be either diagnosis codes, age, any treatments, or some genetic features, you name it. And the recall studies can also be like almost anything for your what you need, such as questionnaires or different kinds of tests, or taking new samples from the patients. And we can use either postal letters or our hospital's online portal to invite patients to participate in these studies. And on the next slide, there's a couple of words for this our portal called Omataus. And this portal enables easier and more flexible participation in the studies, and may also be more cost-effective way to conduct these studies compared to the snail mail or other more traditional ways to contact people. And this Omataus service is still quite new, and it has been piloted once in Biobank recall use. And as we noticed, you have to take your target group into an account when planning your study, and whether to use electronic channels or the traditional letters, as the older people might not be very familiar with this kind of electronic services. But this is what we are for. We can help you to design your study to its most efficient form. And then a couple of words about how to apply for a Biobank access. So we have this service called FinGenius, and it's a common service for all public biobanks in Finland. And through FinGenius, You can get an access to 6 hospital biobanks and the DHL biobanks all at once, or then one biobank at a time. And this service is managed by FinBB, which is a Finnish biobank cooperative, and it's owned by the biggest hospital districts in Finland and 6 universities and a state in a form of DHL. And on the next slide, you can see the process from the customer's point of view. So first, you can instantly screen the sample numbers and also the patient numbers that have given the permission to recalling. And these are aggregate level number in the Finnish biobanks. And by submitting a feasibility request in the a second phase of this picture, you can get more precise and detailed information about the availability of the either samples, or if it's a recall study you are interested in, then the patients that are like available for your research. Or at this stage, we don't know if they are agreeing in this precise study, but we know the number that is possible to contact. So, and the last step in this biobank access process is the access request, which you need to submit the research plan and other documents. And yeah, this is the way to start the biobank study. So I can ask questions if you have questions about this picture, but I guess this is all from me now. Thank you all for your attention, and Paula and Milla will later on tell you how to use all these services combined with HeAT Lab services. But thank you.
Thanks, Annie. And I noticed that Paula and who are the people asking the question, Rodos, they are discussing in the chat. So if you have any questions, you can also put on your mic to talk, because this group is not like a big webinar. We want to have a discussion going on. So feel free to open your mic and ask questions. So if anyone has any questions for Finnish Clinical Biobank Tampere?
I could maybe answer the questions Rodos asked also here for everyone. So he asked whether we have longitudinal sample collections, and basically from all the new people who give biobank consent, automatically we just take one set of blood tests, but for certain patient groups, for example, cancer patients, we take the ctDNA sample before cancer surgery, then we take the fresh frozen tissue sample, and then a set of ctDNA samples to monitor when the patient is monitored for his recovery. For example, every 6 months. So we do have some longitudinal sample collections, and we are able to, if one would need a longitudinal sample collection from a specific patient group, that is totally doable. So it's just needs to be discussed and agreed upon, and the biobank consent for our biobank allows it, or the biobank consent says that it is possible to take samples at different time points. And then Rodos also asked whether we have omics data. So our biggest data set are the electronic health records. So basically all lab results, for example, can be combined with the sample. We don't have a lot of data returned to us from previous biobank projects. yet, because we are such a young biobank. Our first projects were initiated 3 years ago, so it's and of course they take time. But yeah, I don't know if I answered your question, Rodos, or Enni, do you have anything to add?
Yeah, that's all I was looking for. Thank you. Thanks
Okay.
so much, Paula.
Perfect. Any more questions for Annie and Paula? If not, then now we are going to meet Milla from HeAT Lab.
Okay, hello everyone. I hope you see and hear me well still. We can go to the next slide, please, and you can also click to the next animation. So nice to meet you, everyone. My name is Milla Juutinen, and I'm a university instructor in Tampere University. So basically, I'm responsible for teaching all sorts of measurements and processing of biosignals, and then also health informatics. And then in the meantime, also research-wise, I do AI solutions for movement analysis of Parkinson's disease patients. So I kind of have two roles in the HeAT Lab as well. And what is HeAT Lab? It is an environment for health and assistive technology. So we aim that this is not just a location or a physical lab, but it's a network and testbed for all health technology professionals. And then the idea is also that we provide all the expert research services for health technology products, because we are part of the university, so we have all this expertise, and we also want to provide it for those people who really make the products into the market. And you can find us in Hervanta campus, but also in Kauppi campus if you need us there. And if you have any practical questions later on, you can always contact me for HeAT Lab practical issues. You can go to the next slide, please. So what we do in HeAT Lab, I have a few examples that we could have when doing research in health technology products. So for example, if we have a product and we want to prove that it's ready for entering the market, we can do study on those. And then if you go to the next animation, we can also create future innovations that could potentially change the world. So we do this basic research at the university. So to do this base work to get the medical products into the real world is our expertise, and we can also help you with that. You can go to the next slide and maybe roll out the key elements there as well. So since we are in the same faculty with the medical faculty in Kauppi campus, and then we also have the engineering side in Hervanta campus. So we do close teamwork with the Tampere University and Tampere University Hospital. So with this collaboration, we can do all sorts of co-creation projects. We have a possibility to do objective research. So we have knowledge of many different technologies, methodologies, and we can objectively study which one of those are the best for the use case that we have at hand. Of course, we work confidentially. So when you have new products that are not yet launched, we can work with them also. And we do all sorts of development and testing services for new products or products that are already in the market, and we want to get more proof of their work for the customers. And then you could go to the next slide. And I wanted to introduce some of our groups. Of course, these are not all of them, but some from the Hervanta campus. So you can kind of see some keywords, what kind of expertise we have in detail. I myself work in the group of Mark van Gils, and we are called Decision Support for Health. So we do artificial intelligence, machine learning solutions for all health and wellness products and methods. We do a lot of signal processing, decision support, and then we also have expertise in the health informatics standards and regulations. Then we have Antti Vehkaja's group, which is called Sensor Technology and Biomeasurements. So in Antti's group, we have more detailed expertise on actually building sensors, making them into wearable products, but then also analyzing the signals and getting the electronics done. And they have also done clinical investigations and are, of course, closely related to the medical device regulations. And then the third example is Jari Viik's group, Physiological Measurement Systems and Methods. And Jari's group is very traditionally concentrating on all sorts of physiological signals. So how we measure them, how do we get the information that is vital for us, and how we can use the information to help the patients or individuals to improve their well-being. And of course, statistical analyses are very closely related to that. So here are just a few examples that we have behind our environment. So we have, of course, all the research groups at hand, and we have other expertise as well than just this, but maybe this gives you ideas how to, or who should you contact if you have a research question. And next slide, please. And also we can show the, especially if we do clinical research or product research for getting the products into the market, we have all these process steps on the studies. So of course we always do research plan and data management plan for all the studies that we have. And usually if we work with people and patients, we need to, of course, submit the ethical committee application. But also when we work with new devices that are maybe not meant for studying humans yet, we of course need to do the clinical study notification, and nowadays it goes to Fimea. So this is kind of the background work that goes on before anything can really start, and we are the experts on that. But then when we also get to the actual work, so we do measurements on ready-made devices or prototypes, or we can even build devices to make the measurements. We collect the data with the samples that, or individuals that we want to get, and then later on we can get into how to choose the correct applicants, for example, with Biobank. And we can do the data collection, and then of course how to get the information out of the data that we have measured. So we do data processing and analysis. And here we have some examples, for example, from the impedance pneumography measurement, which is measuring breathing with a biosignal recorder. So we can measure an electric signal and get breathing volumes and flow based on that. And I think there's still one bullet there, yes. So of course, after we've done the analysis, then as a university related lab, we of course want to report and publish the results that we have gotten. So of course, depending on the case, whether it's a scientific publication or just reporting to the company and so on. And yes, you could go to the next slide. And so this is very short introduction to what we do in HeAT Lab. And so we are located mainly in the Hervanta campus, but also in the Kauppi campus if needed. And if you have any questions, feel free to ask them now, or of course later if you want to come and visit us, for example, you can contact me for that. And thanks for your attention, and maybe we can have some questions if we have any, and then move on to what do we do together.
Yes. Thanks, Milla. And there was a question if we can share your slides later. Biobank said it's okay. How about HeAT Lab?
Yes, of course.
Perfect. Then we will share the slides to everyone who registered to this event and also the recording. All right. Any more questions for HeAT Lab? We have a couple of minutes, just so feel free to ask or open your mic.
Maybe I can add to this question about sharing the slides. I think we both agree with HeAT Lab that we're happy to also come to any meetings with, if you have, for example, with potential pharma partners, we can also organize meetings and come and present ourselves. But of course, the slides are available. But we're also happy to tell everyone about what we do.
Yes, exactly.
Sounds very good. I hope that you can help Biobank and HeAT Lab. I'm talking to the company to help them introduce to potential partners, and we can develop this whole concept together. So if there's no more questions for them, then we move on to the next special one, which is the collaboration between two organizations.
Yes. So as Enni already told you about the Biobank, what we do is like mostly we're a repository of biological samples and data that is collected for future research needs. And we have a lot of samples, over 3 million, and from 400,000 individuals. And the possibility to link basically any clinical data or other registry data to these samples. So if you would need any lab results or genome data that has been returned from us from previous biobank studies, or information from like pathology reports or anything, we can link them to the samples. But what biobanks are not so well known for yet is this possibility for recall studies. So this means that on top of these samples and the data attached to them, it's also possible to contact patients through biobanks. And as Enni said, we have about 40,000 individuals who have given biobank consent, and of those approximately 90% also give permission to be recontacted for any new research needs. So this gives us quite a big pool of candidates that we can invite to new studies. Can I have the next slide? Yeah. So in this collaboration with HeAT Lab, what we can offer is that we can screen suitable candidates based on the criteria needed. So if you're looking, for example, for people who have a certain ICD-10 code, or have had certain lab results, or have a certain gene variant or anything like this, we can screen them from our pool of candidates. And then we can invite these persons to take part in a new study. So this makes finding candidates or research subjects for new studies a lot easier than it has been before, because it can be made on like based on on information from the electronic health records, and we already know that these people have given biobank consent, and they are likely people that might want to take part in new studies, of course, depending on the study, if it's interesting for them as well. Of course, it's always their decision whether they want to take part or not. So we can find the patients, and also, and when I say patients, I don't only mean hospital patients, also all like healthy persons have given biobank consent, so we have a large pool of candidates. But we can screen them and then invite them, and it is possible to invite them electronically. As Enni said, we have only piloted this once, and we're willing to develop this invitation protocol further, or we can also do it by traditional post. And also, if you would need data or samples from these patients that have already been collected to the biobank, we can also include them. The next slide, please.
Yes, so now that I found my mouse again. So as Paula said, Biobank has all the previous data that has been collected from these volunteers, and this is a huge asset for all kinds of research projects. And we as a HeAT lab, we have technologies, we have expertise, we have devices and methods to analyze all sorts of data, but we don't have the data itself. So every time that we want to study something, we need to collect the data or find it somewhere else. And this is the nice way of collaborating with Finnish Clinical Biobank Tampere, is that we are close by, and you have all the data, and we have the expertise to analyze that, and we also have the expertise to do the recall studies. So then we can combine the history information of the subjects, and then we can provide new information and use those both to test any products or methodologies that you would want as a customer to study on. And so of course we can in that way provide objective validation studies for all sorts of medical devices and methodologies, and especially as we can pinpoint certain subjects or certain groups of patients that we want to study, then we can also really find the suitable volunteers for the project, so that we can see whether device or method is suitable for that group. And of course, as a university partner, we are willing to do all the documents and documentation of the work and paperwork. Then we can do the execution of the study, and then at the last stage we can process and analyze the data, also the biobank data, and then report it to the customer, or then publish it scientifically. And I think that we can go to the next slide, which is about the collaboration, and maybe I can start and Paula can add things. So of course the strength of us is that we have the access to large clinical datasets with Biobank, and also the electronic health record data, which is otherwise quite hard to get. We would need to have all sorts of paperwork to get into electronic health record data through a hospital. But here it is relatively easy. And of course, our expertise is then all clinical and non-clinical research studies, and including all the phases of the project. And maybe Paula can add something if you have.
No, nothing to add at this point.
Yeah, so I think that our collaboration would provide a comprehensive research setting for all kinds of clinical and non-clinical studies, and we have a unique study group management method at hand. And maybe we can go here, and maybe Paula could explain this part.
Yes, so this is just to try to illustrate what the benefit would be for the customer through this collaboration of Biobank and HeAT Lab. So this is a plain process of conducting a research. So you would need to have the idea or the need for the research, formulate the research plan, apply for ethics committee approval, maybe some other permits, have different agreements made up, arrange the study equipment, select and find the study subject, contact them, organize the study visits, execute the study, analyze the data, and then publicate and finalize the research results. But if we go to the next slide, we can see that if the Biobank and HeAT Lab help you, your responsibility, of course, is still to have the research idea and the need, but we can help formulate the research plan with you if needed, and we can also help applying to the ethics committee approval if that is needed in the study. Then we can make all the agreements needed, arrange the study equipment, select and contact the individuals to be invited to take part in the study, organize the study visits, execute the study, analyze the data, and you get the final research results nicely packaged as a result of this collaboration. And then to further illustrate this, we can go to the next slide. So this would be a basic study flow on these steps. So to clearly illustrate that a lot of the work that you might have to do yourself without the help of the Biobank and HeAT Lab would be something that we can really truly help you with. So we would take part of the invitation of the study participants and the study visits, data collection, provide you with any additional data that you might need, analyze the data if needed, and deliver it to you. So you could use it either for business or development or research purposes. Milla, do you have something to add here?
No, I don't. I think you explained it really nicely. So we can divide the workload on
Yes.
on the three parties instead of just you doing all the work yourself.
Exactly.
Great. Do we go to the next slide, which is just the ending slide? And of course, we hope to have many questions and comments on our idea. And of course, if you have further questions later or you want to set up a meeting with us, please don't hesitate to contact us, for example, through email. So you can see our emails, and then we also have Jari Viik and Antti Vehkaja there, who you can contact, and Jari is also present here.
In the chat, we have a question. If we could explain what is required in order to collaborate, for example, research plans, FinData permits, and etc. So from the Biobank's point of view, you would, of course, need the research plan, then the CV of the PI, the DP, what is it, data protection,
Impact assessment.
Impact assessment, and
a record of data processing document.
Yeah. So those are the documents that you would need to make an access request for a recall study for the Biobank, and also an ethics approval, which we can help you with. Then FinData permits depend on the data that you need. If it is data that is accessible through us or that you collect only through the study participants, then you would not need a FinData permit because all the data comes from one registry. So, but would you need anything that is or if you need to combine data from different registry holders, then you might need a FinData permit.
Thanks, Paula. Did she answer your question, Katrina?
Hi, can you hear me?
Yes.
Yes, okay, great. I had myself double muted. Yes, you answered some of my questions and I had a few more. I was just starting to type in there. So do you have any experience with the Fin data permits? If you did this with anyone, like how long does it take to actually get access to collaborating with you?
If you need FinData permits, I'm afraid right now it's a little bit long, the process. So if you would not need any data that is from FinData, then it would be significantly faster. So if you could operate with just a hospital or like the Biobank data, but right now FinData, it's I think about 6 months to get the permits and get the data.
Okay, thank you.
But without FinData, it's significantly shorter time. It's about month or two regarding of your request and the time we need to collect the data. But in Biobank studies, it's about 2 months approximately.
Okay, and then to summarize, you said you needed the research plan, ethics committee approval, a DPIA, and I think there was one other data processing.
Yeah, record of
Yeah.
data processing.
Okay.
Yeah, I was writing it on the chat, so I can have it in writing in the chat, the set of documents.
And those are the documents that you need for the Biobank access. So if you would conduct this kind of recall study, you might need some other permits as well. For example, Milla, you mentioned the FIMEA or notificating FIMEA. So but it depends on the research quite a lot.
Yeah, it depends on the research and the devices. So at least the FIMEA application is for using devices that are not strictly medical devices yet. So for example, using a smartphone or some other device in a study requires that.
There was also a question in the chat. Is there a sample set of how the data is packaged or some APIs to access? Is there documentation on this? So if you mean the data, do you mean the data that comes from the Biobank or the data that is collected in a recall study and possibly analyzed in HeAT lab?
I intended this question with the retroactive looking, but I guess this is the first I've heard of the recall study, so it was a new idea, but I guess it'd be helpful to understand, like if you have like a example of what exactly is it that's coming out as maybe a single totally anonymized, example, just so that we know what exactly is there. I mean, without having a catalog of knowing what possibilities exist, I just something so that we can have a better understanding of, because as we're trying to think and evolve like different, business concepts, it would be nice to understand what exactly is possible if I'm trying to explain that a bit better.
Yeah, so yeah, for the biobank data, yeah, it's a little maybe even difficult to explain, but what we normally provide the patient, the customer with is what they ask us for. So, for example, all the diagnoses that have been recorded for this patient and all the medication that he has used between certain time points, all procedures that have been done, maybe some we can also do text mining to find out, for example, smoking status and things that are not easily findable in the EHR data. But Milla, for your part, do you want to give some examples?
Yeah, well, my one thing to add is that, of course, you can look at the FinGenius database to see like what data types are there. And as Enni said in the first presentation, from our side, I would say that whatever we measure, we can report. So I think it depends on what is the business idea of the company that we're working with, or what is the device that they want to test. If they want to compare it with other physiological measurements. So like one example to compare the stress data from mood metric to a reference device measuring EDA, so electrodermal activity. That's one study example that we've done in the past. So I think that whatever we measure, we can also share. So it's hard to give like an exact example what we could have in the data.
All right. Is there any more question? We have a lot of time left, and this is also the last slide of our event today, like more like networking meeting. So if you still have the any questions or just comments on the presentation, please feel free to do so. And you are welcome to open your mic and camera again. If we don't have anything left, thank you so much, Enni, Paula, Milla, Jari, and Antti, for making the presentation and for your speech. And I think that this is the end of our meeting today. And I hope that after this meeting, you can give me some feedback about this kind of meeting, so we can organize more of this short and small meeting more like this in the future, so that you can have a chance to ask more practical and deep questions regarding your company. So I hope that you enjoyed this meeting, and please feel free to reach out to these experts and ask them more questions, and they are very supportive and helpful. So don't hesitate. If you have any concern about your company, they can always help you, and if they cannot do something, they will refer you to someone else who can help you. So please do so. And also, thank you so much for coming today. And I think we can end the meeting now. The recording and the slides will be sent tomorrow, but the feedback form is already sent right away after we end this call. So if you still have anything to ask, now we have a couple of minutes still, otherwise I will end this call. Anyone? All right, I think that is it. Have a nice rest of the day to everyone. And I am Vanle. Please feel free to reach out to me at any time if you need to. Of course, we have a lot of other test bed as well. I hope that I can organize this similar meeting in the future. But today you get to know Biobank and HeAT Lab and their collaboration. So they are also together with us learning how to build the services better. So if you have any idea as a company, you can see there's something that we can change to make our services better for you, don't hesitate to let us know. And that's it. Thank you, everyone. Bye-bye.
Thank you. Bye.
Thank you.
Thank you.
Bye.
Bye-bye.